Good evening, ladies and gentlemen, and thank you for joining us for another edition of the Family Empowerment Discussion. And this evening, we will be delving into a topic that is a little bit sensitive and I believe is of utmost importance for each and every one of us. Over the tenure of this program, one of the things that we have tried to do is to look at mental health. And this evening, we want to look at mental health in children. Now, I am your host, Corporal Kester Fennel. And with me this evening, we have a representative from the Mico Care Centre. Now, she is Dr. Shauna Miller, and she is a child psychologist at the Mico Care Centre. And we want to look at the topic this evening: is there hope for children with learning disability? Now, that is a question that I want you to ponder. I want you to think about it as this program goes on. And whatever questions you may have, you can have them ready as we go through this program. Now, we want to kick things off with her as usual. And to do that for us, we're going to ask Constable Chantel Powell to do the purr for.
Let us pray. Father, in the name of Jesus, we give you thanks. Thank you for your grace and for your mercies. Thank you for always looking out for us. Thank you for loving us beyond our wildest imagination. As we gather for this meeting this evening, I pray in the name of Jesus that your presence will be with us. I pray that this discussion, mighty God, will not go in vain, but parents and teachers and other stakeholders who are present here, police men and women, will learn strategies how to deal with mental health in children. And we are declaring over this platform that there is in fact hope for our children who are struggling with mental health. I pray, Spirit of the living God, that your presence will be on this platform with us. I pray the discussion will go, mighty God, in a way that will be fruitful and productive for all who are here. Have your way in this meeting. In Jesus' name I pray. Amen.
Amen and amen. Thank you, Constable Powell, for praying for us. And I want to say a big welcome to each and everyone who are joining us this evening. We have persons from various communities across St. Catherine and other parishes. We have principals, we have guidance counselors, we have justices of the peace, we have personnel from the JCF and the JCF High Command that are currently on, and we want to say welcome to you, as well as we have representatives from various stakeholders like restorative justice who are currently on with us. And to you, we want to say good evening and welcome all to the Family Empowerment Discussion, where we educate the family. Now, to get into our discussion, we have Dr. Shauna Miller. And if you are looking, you will see her on our screen. Dr. Miller? Wonderful. She's waving at us. All right. So, Dr. Miller, just for the purpose of edifying our audience, we would like for you to just open your mic, go ahead and tell us a little bit about yourself.
About myself. So I'm a school psychologist, which I was trained in the States, and they have school psychologists there, which is really like a child psychologist that does primarily works in the schools, learning to treat children who have various behavioral, social, academic needs, learning to identify and figure out interventions for them. So that's my training. I work at Mico Care, of course. I'm a care representative in Mico Care as a psychologist, and I primarily do assessments with students, kind of looking mostly at, cognitive and behavioral concerns. Is that?
Right. Thank you so much, Dr. Miller. So without a doubt, you are certainly more than qualified to speak on this topic for us this evening. All right, so let me ask you, do you have like a presentation that you want to do before we go into the discussion, or you just want us to delve right into the discussion?
I'll just, I didn't, no, I was thinking it was more of a kind of a discussion. I'll answer any questions you guys have. Yeah, we'll kind of go that way.
Not a problem. All right, so let's just get into things. Can you give us an overview of what the Mico Care Centre does?
Sure, absolutely. So the Care Centre, which actually stands for, I hope I get this right, Child Assessment and Research and Education Centre, has been around for over 40 years. It was started, so the idea came about somewhere in the 70s as a joint project between the college, Mico College, of course, and with the Norwegian government. And they really wanted to kind of promote special education, promote kind of help for students who have special needs. So there was the training that happens at Mico College for teachers to, do interventions for children with special needs. And then the center was there formed really to do assessments, identify needs, promote interventions, have a multidisciplinary approach. So that was a foundation. Right now, we primarily do assessments. So we help to identify children who have challenges in school. So if there are children in school who have various problems, right, we help to identify what is the nature of the problem through assessments. We provide some intervention. And as I said before, we take a multidisciplinary approach, meaning so we have psychologists like myself who help to do the assessments. We have social workers, we have special educators, we have a nurse, and we currently have a speech therapist, which is very, very needed because there are a number of children with speech and language problems. So we have a multidisciplinary approach to kind of figuring out what the needs of the children are.
All right, thank you. That sounds good. And I like the fact that you say you take a multidisciplinary approach to looking at the issues in children, because I think that one of the things we lack here in Jamaica, especially within our education system, are enough persons who are able to treat special needs children. And I think, because of that, the children lose the benefit that could come from having those persons around. And so, it is important to know that you guys take a multi-dimensional look at things. And so who are the primary beneficiaries of the services provided by Mico Care?
So we are a child assessment center. So we work with children, all children across the country, any child from any community, really, is open to our services. We have a branch in St. Anne, we have a branch in Mandeville, and of course, Kingston. So we see children from across the country. Anyone from, I should say from 4, actually. So younger kids, not quite yet, but from ages 4 up to 18, we'll see, children, all children.
Okay, thank you. So from ages 4 to 18.
Yep.
Okay, so that means then that we are taking them from the kinder level. So
yes.
At the very basic level of education, at that stage, they can be assessed and any possible problems can be identified with the intent of remedying that problem, so that throughout their education, at different levels, that can be addressed and the necessaries can be put in place.
Right? Yeah, I would say my personal philosophy, and I mean, I think the philosopher, honestly, any clinician, is the earlier that you can identify any concern, the earlier you start to intervene in any kind of issues, the better it's off for the child. So you really want to, is there any concern that might be happening really early on? You want to see, is there a deeper issue that we should be addressing? And really, the earlier you start intervention is the better it's off for a child.
Wonderful, wonderful. And I do agree with that concept too. I want to take the time to acknowledge our commanding officer, Superintendent Hopton Nicholson, who has now joined us on the platform. So I want to say a good evening to you and welcome, Superintendent Nicholson.
Blessings, I'm here. Thanks for having me. I'm just here, up trying to multitask as usual. I'm thankful that I'm here.
Got you, Superintendent. All right, thank you for joining us. And ladies and gentlemen, I want to tell you that you can join in this discussion if you so wish. If you have a question, you can use the raise hand feature that is there on the platform, or you can type your question in the chat and we will address those questions. All right, so you can feel free to delve into this discussion at any time by using the raise hand feature. Right, so Dr. Miller, can you tell us what are some of the learning disabilities or challenges that we see in children today?
Sure. I think, so for, let me take it from this direction. When we have a child that comes to us at the center, or if you have a teacher that recommends an assessment for a child, it's usually because they're seeing some concern that maybe they're not completing their work, maybe they're distracted, maybe they're having problems with reading, writing, or math, right? So any of the academic concerns. And the goal for an assessment is to try to figure out, because it may be that they have a reading problem, but it may be some other issue that is behind it. So that's the whole goal of an assessment. That's why we have a multidisciplinary team. We do a number of different measures because we really want to try to figure out what is the cause for the lack of performance, because there could be many. If I want to stick to learning challenges, so let's say the cause, because it could be behavioral or emotional challenges that's behind it. It could be family issues, but if we want to stick to, let's say that there's a learning issue, it could be that there might be an intellectual problem, meaning that they have problems with general reasoning, general learning, which would affect their schoolwork, but it would affect a number of different areas. So maybe a child just had difficulty, just like we have some children who are very, very quick at learning and, you know, very, 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 then we can have on the other side of it, children who take a long time to learn concepts, need a lot of repetition. So it could be just a general cognitive problem. It could be that a child, and we see this a lot of times, that children are good reasoning, they have good reasoning skills, but for some reason they have difficulty with actually learning how to read. We call that a learning, that's what we would call a learning disability. So they might have a specific learning disability in reading or in writing or in math. So they might be good at math, have no problems. They're good in their orals, right? They talk, they reason just like any other child. But when it comes on to the reading, they're just having difficulty. They can't seem to quite get it. So that's what we would call a specific learning disability, which is different from having general reasoning concerns. So those are the primary learning challenges. Other ones that we often see at the center, I will say though, related to that would be ADHD, right? So having problems with attention deficits. So that's really more of a behavioral almost concern. So it's children who have problems with self-regulation, and so they have trouble focusing and getting themselves to complete tasks. Of course, that's going to affect their learning. So it may be that they actually, even though they have poor grades, it might be that it's because of their inattention or their inability to concentrate or their inability to complete work for other reasons why they're having problems with schoolwork. So ADHD is a common diagnosis, I would say, for children as well. Or, you know, we might have on a less common, but certainly present is something like autism. Yeah, so those, I would say those are main ones. We have intellectual problems, we have specific learning disabilities, we might have ADHD, and we do see a fair number of children with autism, which again would affect learning, even though that's a more broader disability rather than learning, but it certainly affects learning as well.
All right, thank you. There is one though that I didn't hear you mention, and I'm happy that you know, in a nutshell kind of explained, especially ADHD. And one of the things that I recognize is that most times in schools, because from here at our office, we work with a whole lot of schools, from basic schools all the way up to high schools. And usually we have to do interventions whenever it is that children exhibit behavioral problems. And in many of those cases, those students are really non-performing students. And so the question then is, or rather, I'm positing then, based on what you have indicated, is that a lot of those challenges that the teachers are having in the classroom with these students may be directly related to some learning disability, some cognitive issue.
Yeah, there's certainly there's a strong association with learning problems and behavioral challenges. So
right.
No, and immediately are. So you may have children who really, like I said, have intellectual problems or have a specific learning disability. So they have, for some reason or the other, are having problems with learning. Now you'd imagine, and I say this to parents all the time, particularly when you reach like grade 3 and grade 4, these are children who have been struggling in school always, right? And none of us want to be in a position where we are struggling day after day in a situation where we're struggling to get what everybody else thinks to get. And then you might start to see behavioral problems because nobody wants to feel like they can't do anything. So they might start to act out, etc. So especially as they get older and they're continuing to have learning challenges. So if they primarily have learning challenges, they might begin to have behavioral problems because of the discomfort of being in a setting where you feel like you can't do anything. So that's definitely one. On the other hand, it could be that the behavioral problems cause the learning problems. So just as I said with ADHD, you have children who for some reason or the other, right? I mean, this is very brain-based, for some reason are just more impulsive and have problems with self-regulation. And so even though their learning potential is okay, they're still all over the place and they might get into trouble all the time. And then you start to see other behavioral problems, especially if it's not addressed early on. Early intervention is always good. So if it's not addressed early on and these children are very impulsive and have problems with self-regulation, they might get into more and more trouble and it affects their learning because they're not paying attention, etc.
Okay, understood. I want to ask you though, have we seen any cases of dyslexia?
So dyslexia, so that's just dyslexia is really just that same term of a learning disability in reading. Some people call it dyslexia. Just like a specific learning disability in math might be called dyscalculia, or a specific learning disability in writing might be called dysgraphia. So of course, that certainly it does exist in the schools. So all of the typical learning challenges that exist elsewhere certainly exist here. One of the difficulties, I would say, in trying to determine, is this a specific learning disability in reading? So like dyslexia, is that it has to be, one of the compounding factor is that it has to be just a problem with reading. So it's not affected by, say, trauma or by poor, like a poor educational background or by other factors. And sometimes children come from places where there are multiple things going wrong. So it's hard to say, is this dyslexia or is it some other, if there's a lot of chaos at home, that might be the reason for the problem, the reading problem. But certainly, regardless, there are definitely absolutely children who have dyslexia or a specific learning disability in reading, meaning everything else is fine and for some reason they have problems with reading.
Okay, all right. Thank you so much for that. So we are recognizing now that a lot of the issues that exist within our schools with the children may be related to some either learning disability or an intellectual problem, right? You want to just go ahead and just differentiate between the two things for us? Let's get a better understanding of what is a learning disability versus an intellectual
disability. So an intellectual disability, like I said before, is if a child it's the other end of the scale. You have children who are very gifted, learn very quickly. They might be above us in terms of their learning, right? So they grasp abstract concepts very easily. They're very able. On the opposite side as an intellectual disability, meaning that overall their learning, it's much harder for them to learn basic concepts, and they need a lot of repetition. So an intellectual disability means that you're just your general thinking, and it affects all things, not just academic work, but you might see it in terms of, they seem to have a problem with, they're not quite their age. They don't act like their peers. They might be a little bit more immature, right? They might be a little bit more naive, a little bit more gullible, right? So it affects everything. So children with intellectual disabilities have really weak reasoning skills overall. A learning disability, on the other hand, like dyslexia, a learning disability, they reason, they have the same social skills as their peers. They're savvy in other ways. They might be good, they have street smarts. They might be fine in other areas, but for some reason they have problems with reading. We don't really understand why that is. Sometimes parents will ask, well, what is the reason behind this? We don't have, and we don't know. I just say, just like some children are tall and some children are short, it just is. It just is. We don't have a reason for why some things exist, but for some reason, some children might be fine intellectually, they're okay in terms of their oral reasoning, but they really have a hard time learning to read or learning math, right? They might be fine with reading, but for some reason they mix up, they have a hard time learning math facts. You know what I mean? It's just like they keep making the same mistakes over and over. And that is what we would call a learning disability.
All right. Thank you so much. Thank you so much for putting that into context for us. All right. I see Hopton SP Nicholson's hand being raised, but just before you, Sir Nicholson, there was a question in the chat from a Shellyan Dillion Burrell. And she's asking, what is the support given to the school or the teacher once the assessment has identified a learning disability? So I think that one's for you, Doctor.
Yeah, absolutely. Primarily, so the primary product, so we do our work in terms of trying to figure out what is the reason for why this child is underperforming. That's really what it is. What is the reason? Is it a learning disability? Is it a behavioral disability, etc., whatever it is? And looking at their profile, then we usually make a lot of recommendations through the report as to what, based on what we've seen in the assessment, what do we think is best for this child in terms of remediating the problem? So is it primarily a behavioral issue, in which case we'll make recommendations for how the school and parents need to go forward in terms of trying to create more self-regulation for this child? Or if it's a learning disability, then we'll talk in detail about what steps need to happen next. So the report usually has the information on what we think is best next. Apart from that, we also, Mico also has a lot of workshops, etc., working with schools in terms of following through with some of the strategies. But primarily the report is very individualized. So we spend a lot of time with the children trying to figure out what exactly is going on. And then we make these recommendations based on what we've seen. So the report is really the primary avenue for getting that information.
Okay, thank you so much. So I do hope that your question was answered. So in other words then, once the report is given to the school, is that where things end for Mico Care?
Yes.
In terms of the report and the recommendation? For
that individual child, yes, absolutely. Like I said, we have many workshops that's more broadly geared towards, but for the individual child, yeah.
Mm-hmm. Okay, thank you. All right, so SP Nicholson, you had your hand raised. I don't know if you want to go ahead now and make your point or ask your question.
All right, thank you, Mr. The question I want to ask is a two-part. The first part has to do with, is the socialization or re-socialization of persons or children, can that solely be one of the solution to learning disability? As in, and I say it against the background because we have individuals within communities who are doesn't have the parents or the kind of guardian to assist them. However, there's a disability. Can the re-socialization process, taking that child out, be the end all solution to the problem? That's part one of the question I'm asking.
Okay, so you give me part one and then part two. All right. So the reason why we do, okay, so that's in some ways that's complicated. So like I said, we see a number of children who have learning problems. And like I said, it's hard to identify sometimes, is this a learning disability because of the multiple issues that may be going on for a child. So particularly if they come from more chaotic backgrounds, right? If there's a lot of disruption, if there's a lot of trauma in the past, that certainly affects learning. And so it can be hard to say, because that absolutely will affect learning, right? So it's hard to say, this is a learning disability, that the child may be underperforming in school, but because there's so many things going on for the child, it's hard to say that this is just a child factor. It's just because they themselves have a learning disability, because there are all these other things going on. So particularly when we have children like that, yes, you need a multiple approach in terms of trying to solve the issue. And for some of those children, because the primary reason for their underperformance is the chaotic background, I would say for some of them, yes, if there's more structure, if there's more consistency, if there is more parenting occurring, then yes, that can help in terms of the underperformance, because for some reason for some children, that was the primary reason for their underperformance. But for some children, even if it is that there is an actual learning disability, right, which is different from just underperformance because of emotional concerns and social concerns. So if there's a learning disability, they'll still need specific strategies to kind of help them overcome their challenges, if that makes sense. So absolutely, re-socialization or providing more consistency and structure will help many children, most children. But for some children, probably still will need additional help depending on what the nature of the problem is.
Right.
All right.
Thank you. The other part of the question is there studies to show any direct correlation between learning disability and juvenile delinquency or crime, or in that way? Well, in our instance, it will be crime, but for juvenile, they call it juvenile delinquency in that regard. Is there any? And does the literature just say anything that is have direct correlation with that in that regard?
I'm so sorry, something was going on outside. All right, you were asking if there's an association between learning disabilities and an increased likelihood of crime and juvenile delinquency, right?
Yes, that's the question. If there's a direct correlation, yes.
I know, certainly, okay. I will say there's much more association with more behavioral disorders like ADHD for sure, ADHD, and an increased likelihood of juvenile delinquency and crime, assuredly. For learning disabilities, I don't want to say, I'm not sure, I can't say for sure if there is. I would tend to think that there is an association. It's not going to be as strong as the one for ADHD, that there probably is an increased likelihood. Okay, there's absolutely a correlation between children who have poor reading skills early on and a likelihood that they're going to end up in criminal and juvenile delinquency. Now, it's not necessarily that they might have a learning disability, but for whatever reason, there is absolutely a link between children who have reading issues early on, academic problems early on, and later problems in a number of social situations, unfortunately. And a greater likelihood to end up in the criminal system for sure.
Noted.
All right. Thank you so much, SP Nicholson, for those questions. And thank you, Dr. Miller, for your responses. And I think based on your response, though, one of the things that I'm picking up is that the environment that a child is raised in can cause that child to present with what appears to be learning difficulties or learning disabilities, when really and truly it's just the stress of the environment that is causing that behavior in the child.
Yeah, absolutely.
Okay.
we definitely know that.
So once again, it is emphasizing the importance and the need for us to have healthy environments for our children growing up, and especially how important it is to their education. And that is a bit of information for each and every parent to take from this program this evening. All right. Sergeant Cecil White, I see that your hand is raised. You can unmute your mic and go ahead, Sir White.
Yes, thank you, Sir Fennel. Good afternoon to
you.
Persons on the platform. Dr. Miller, I guess when it comes down to children, it's really very complicated nowadays. I mean, I remember when I was growing up, I don't know that it was this complicated. But, one of the concerns, though, that I'd like to highlight and maybe see if you can shed some light on, is that oftentimes in our layman term in Jamaica here, you hear it is said that the child is slow. I'm quite sure everybody would have heard and familiar with that term. The child is slow. And the child is slow, especially when it comes on to school, at school, and the child performs there. In terms of a learning disability, well, one is convinced that, well, yes, no, that obviously something is wrong. Who reaches out though? Does the parent or the teacher reach out to your center for some sort of assessment? And if so, tell us what's the procedure really. And and I have another question after that. Thanks.
Sure. Yeah, so yes, I'd say being slow is probably one of the most common unofficial diagnosis that exists out here. In terms of the procedure for the center, really parents or parent, guardian, etc., is the one that has to follow through in terms of the assessment. So typically what happens is that either a teacher, most often the teacher, sometimes doctors, depending on what the situation is, most times teachers will encourage parents to go to Mico to get an assessment because it's a parent that has to follow through. So in terms of the procedure, there are a number of intake forms that the parent has to fill out. So they have to fill out information from themselves. They have to fill out information. They have to get the school to fill out some basic information. And they usually have to get a preliminary medical check because, we want to cover our bases in terms of what's going on for the child. So that they can come to the center, or it might be available on our website. I think the website is currently down, but once it's up there, those forms are also available on the website. So they just need to get the forms themselves, the intake forms that I just talked about, get them filled out, bring it back to the center and register, essentially. But it really is the parent that has to follow through.
Okay, great, madam. Thank you for that. The other part to my question, not really connected, but has to do with children also. And one of the, well, I think in my estimation, it is becoming very widespread, and even so in Jamaica now, the question of autism, where, a lot of times we have our children and, we realize that that child is not really behaving like the average child. And, a lot of times we as parents and guardians really don't pay that much mind. And, I am just wondering, in terms of diagnosing for autism, if your center, delve into that, or there's a special, process where, the child and parent is referred to, other persons for that. And, and a lot of times we see too, because based on, when you compare children, let's just say I have a 3-year-old who a 3-year-old, that child is talking and behaving, very superior compared to maybe a 7-year-old who is not, who is not even talking that, that clearly, So I'm just wondering if those are some of the signs that as parents, guardians, we can look at, to at least say, well, look, like something is going on with my 7-year-old or with my child, You can expand on that.
Sure. Yes, we absolutely do assess autism is one of the things they assess for. And I'd say we are absolutely, just like I think everywhere globally, honestly, are seeing increasing numbers of children presenting with autism symptoms for sure. Part of that, people ask me why, part of that is just the increased awareness. So I think there's sometimes, especially children who are, I would say, higher functioning, meaning they are in the typical school, but they're just maybe odd in many ways. Those children probably previously would have been just seen as odd and just overlooked. Whereas now there's an increased awareness that some of the behaviors that we're talking about is probably related to autism. And so there's an increased awareness that, maybe we should get this child assessed and determine, is this autism? So there's an increased awareness. Some of that is that there is just an increase in the numbers of children presenting with autism for whatever reason. So yes, we absolutely do assess for children with autism. In terms of warning signs, so if there's one thing I want to repeat many times is early intervention is better. The earlier you start an intervention, the better. Earlier that you start to address a problem is better. Often, a child who isn't communicating clearly, absolutely. I'd say many times, especially early on, if there is, I'll talk generally about warning signs. So if a child starts to speak late, there's often the idea that, just kind of wait it out, we'll see. Earlier the start intervention is the better, always. And the reason for that is that, and it's not necessarily that is an indicator of autism, it is sometimes, but speech and language problems are pretty widespread. So it may or may not be autism, but regardless, if a child has a language delay or a speech delay, you always want to address it. Because even if a child starts to pick up over time, let's say they start to pick up, children who their same age have already moved on. And so there's always a gap. And the longer that you wait, is there an increased gap. So you really want to, as soon as you see any kind of issue, honestly, you want to address it so there's less of a gap between that child and their peers. Because even if a child is delayed and starts to make progress, their peers are already making more progress and they've already had a head start. So you always want to address, if you see a delay or if you're concerned about delay, you always want to at least start to do something to address delay. Don't ignore it. Don't wait till it's address it always. Was there something else I wanted to, was that address everything in your question?
Pretty much, ma'am. Pretty much. Yes,
Okay.
You touch on the indicators for autism, and of course, action, not to
Sure.
delay.
I'll
Pretty
say
much. Yes.
more broadly in terms of autism. So I talked about a language delay, which is definitely sometimes an indicator for autism. The thing with autism that I'll say briefly, autism is really a combination of communication issues. So it may be a language delay, or it may be just they're odd in terms of how they use language, right? So they may not have had any kind of language delay, but they mix up their pronouns, or they kind of speak very oddly, or they have problems with what should I say? Like they don't seem to get things that other children their age get, right? So they take things very literally, right? So there's a spectrum of how those communication challenges might look. And then there are also usually, along with it, a lot of rigid behaviors, right? They have problems with transitions, or they have to have things done a certain way. They might be very picky about they're very particular, I would say. So it's a combination of things. So if you see those kinds of things in your child, the other thing that I did want to say, sorry to hijack anything, is that one of the things that I've found is that parents are so reluctant to have their children assessed, or so reluctant, which is understandable, to try to see, is this an actual diagnosis? Like I said earlier, the earlier that you address something is the better. But also, there are many evidence-based interventions that are effective. So it's better for you to get treatment, right, than to ignore an issue. So I often say, I mean, the medical model, I feel like, is helpful in some ways. You might see a person's presenting a particular symptom, and it's better to understand why that symptom is presenting so that you can effectively treat it, as opposed to ignoring it and it becoming a bigger problem later on. So even though I understand that parents are fearful sometimes of a diagnosis, the diagnosis is there to help get the problem addressed. And often there are very effective methods for addressing the issues early on, instead of waiting until a later date when they see more issues. Yeah.
Thank you so much for that response, Dr. Miller. And thank you so much, Sergeant White, for those questions, because I think that, this was a big learning moment for many persons, especially when it comes down to the issue of autism. And, it is so important. And I love the fact that you mentioned the spectrum, because the truth is that there are some persons can be autistic or can be on the spectrum, and it's mild versus others. And so, getting the child assessed is important to know what level it is they're at and how best it is that that issue can be addressed, and how the child can be assisted to help with their transition through their communication and their socialization, etc. Right? So thank you so very much for addressing that, Dr. Miller. There is a question in the chat that is being asked by Professor Colin Jarrett, and it says, how are the police integrated into the process of learning disability and mental health of our children, especially in community development? And I think I want to tackle that one a little bit. And if you want to add anything to it, Dr. Miller, you can do so afterwards. All right. As I indicated earlier, we here at the Community Safety and Security Branch, we work with schools. We have what is called a Safe School Program. And through our Safe School Program, we usually have school resource officers in schools. Whenever we're not doing that, we are attending, meetings, we're doing sessions, and we're doing presentations to children that present with behavioral issues. Now, one of the things for us that is important is looking at things in a holistic way. Whilst we're police officers, and it would be easy to go into a school and rough up a student that has behavioral issues per se, we understand that those behavioral issues that are presenting may be associated with some underlying issue. And it is important for us to be able to understand those issues so that it helps us in our daily job. It helps us to be able to more effectively treat with children who have behavioral issues. And we don't just do that ourselves. We work with various stakeholders. And, we have the Child Guidance Clinic, we have CPFSA, and other agencies that we work with in that regard. Because at the end of the day, it is important for us to intervene early, as Dr. Miller said. And once it is that a child presents certain behaviors and we, the police, go in, we do our own little assessment and we will make our own recommendations. We're not doctors, and so therefore our assessments won't necessarily be correct. But, based on what we're seeing and based on our experience that we have garnered over time, we're able to say this may be an issue, that may be an issue. And even when you sit down with parents and those children, we get to understand that there are sometimes things that exist within their home environment that is negatively affecting that child. And that may also be why it is that the school is having issues with them because of what is happening at home. And as indicated earlier by Dr. Miller, there are things in the home that can cause a child to present with learning or behavioral challenges that are not necessarily intellectual or learning disabilities per se, but just how the child is being affected by what's happening at home, the child presents with that issue. And of course, if we are able to help our children, then we are certainly helping our communities and we're helping our society on a whole. And so that is why it is important for us as the police to be able to play a role in this and to have a good understanding of all of these things and what's happening with our children so that we are in a better position to help them whenever we are called upon. All right. So that is why how I believe the police is integrated in the process. All right. So I don't know if that answers your question, Professor Colin Jarrett. All right. And I see Mr. Luars has his hand raised. After I ask my question, Mr. Luars, we'll get to you. All right. Is there any education campaign that is taking place as it relates to Mico Care and what they do? And as it relates to educating the public on the various learning disabilities or intellectual disabilities that children can present with?
Okay, you mean, is there any campaign that Mico Care is currently undertaking?
Right.
Well, we usually run a number of workshops, as I said, throughout the year. We're currently gearing up for, we have, every 2 years, we have a big conference geared for teachers, where we have a number of presenters to help in terms of trying to figure out how we can teach students with learning challenges in the classroom. So this year it's going to be in October around Heroes Day weekend. So look out for information on that. So we have conferences that we have every 2 years, and then we also put out usually some publications as well, which we're going to put out this year in terms of, again, having different articles like similar to presenters to address different topics that are relevant for how to teach children with special needs.
Okay. All right, thank you for that. So whenever you are sending those out, it would be nice if we could get it so we could share it with some of our community members or schools, parents, etc.
Absolutely.
All right, thank you so much.
You'll be on the list.
Definitely. All right, so Mr. Luars, Mr. Robert Luars, you can unmute your mic and go ahead. Good evening to you, sir.
Yes, good evening, Corporal Fennel. Good evening, Dr. Miller.
Good evening.
Yes, I was actually in a graduation at my school. Corporal Fennel know the school well, but actually I log on there and I hear the conversation, but on my way home, I break up on the way. So, Dr. Miller, I don't know if you had addressed this question that I am about to ask. If a child come to school and have learning disabilities and so on, and the Mico Care Centre understand that it is a problem from the home, do that center go at the home and do some investigation and counseling and so on?
Yeah, unfortunately, we are very limited in our capacity to carry out some of the interventions that are recommended. I would love if we were able to, especially our social workers, I know would absolutely love if they were able to kind of go into the homes and actually do some of the things that we recommend in terms of helping the parents. But unfortunately, we don't have we are very busy with the number of cases that we see. So we have some interventions that occur in the center, but we are absolutely not going out into the homes to carry it out. So we really try to refer them to agencies that would carry out, would help in terms of helping the parents or providing some support for the family. So we do a lot of referrals instead.
Okay.
Okay, thank you.
All right. And just to follow up on that, Dr. Miller, what are some of the agencies that you would usually make referrals to for parents to get assistance?
We refer to some of the agencies that you mentioned in terms of like child guidance, so
CPFSA.
Yes,
Yes, it can be a bit of a tongue twister.
Absolutely. Yeah, so I know that there are other agencies, the social workers are probably much more aware, and then there are agencies that run behavior programs. We'll refer them sometimes to behavioral therapists. Yeah, so we have a number of different counseling agencies that we kind of refer them to kind of follow up in terms of putting into place some of the social and emotional strategies that are needed for the kids.
Okay. All right. Thank you. Thank you so much for that. And the reason why I asked that question is, based on the fact that, what Mr. Lewars is asking about, I know that that is one of the things that CPFSA does. So if it is that, a report or a referral is made to CPFSA, they will go into the homes and they will do their investigations.
Absolutely.
Right? And then whatever intervention is needed, they can or they will implement it from their level. And they do provide support for parents as well. As also, we know that the National Parenting Support Commission, they do provide support for parents as well. So that is one of the agencies that parents can reach out to if they need support with their children, right? So there is a question in the chat that is being asked by Avril Level. All right. And the question is, what are the options available for parents who has a child diagnosed with ADHD and who experiences corporal punishment from teachers in the mainstream school system?
That's an interesting question. Meaning so in terms of the idea of corporal punishment, I'm pretty sure that it's been put out that is not allowed in schools.
That's
so any parent that has children who are experiencing that, they need to follow up, certainly at the school level, at the principal level, at the ministry level, to ensure that is absolutely not happening, because that's not an appropriate punishment for any child in the school system. Any child at all. So I'd say in terms of addressing the corporal punishment part, then I would say that in terms of honestly, in terms of if you're talking about school interventions for ADHD, we have a wide range of schools, and it's hard for me to say. There's some schools that are much more, what should I say, proactive in terms of their policies, in terms of trying to, especially pursuing positive behavioral intervention. But not all schools are that way. So it's hard for me to say for school-wide what happens. It really depends very much on the principal and the school. But there's some schools that are really putting into place much more structured, positive behavioral support, which is really necessary, I'd say, for all children, but particular children with ADHD.
Right. Okay. So so in other words then, and I think what this question indicates too is once again the shortfall in our school system in terms of having teachers who are able to deal with certain behavioral issues in children, right? Because if the child has been diagnosed with ADHD, and if this is something that is known to the school, this is information that the school is privy to, then it means that there should be some specialized attention or program that should be in place for that child or for those children. And that brings me to a question that I did see in the chat earlier. And I'm trying to find it. Right. It's from Elvia Wright, and the question that she's asking, has Mico Care made the proposal to the Ministry of Education re-putting in place social workers in schools? Can you speak to that?
I don't know that Mico Care has specifically made that proposal for the ministry. I mean, I would believe that the ministry itself probably, in terms of their special education department, I probably think that that is something that they would be working on. But I can't say that Mico has specifically asked for that for that intervention.
Okay. All right. So now that we're getting a better understanding of Mico Care, we're getting a better understanding of, the different types of, we're learning the difference between intellectual disability versus learning disability and all of these things. Do you have any success stories or any examples that you can share with us here this evening about how Mico Care would have positively impacted any child or family?
Honestly, okay, so we do also, in addition to the assessments that we do, and we do get feedback often, honestly, from parents, particularly, I would say, because the students that we assess, particularly if they need specialized accommodations to help them in exams, I would say that's one of the things that is definitely a strong positive for parents. So we identify children who need extra help, and we ask for that, and they get that through the ministry. And that many parents have come back and given us feedback as to how successful the children have been because they've been provided with the appropriate support that they needed. So that's definitely one avenue of parents giving positive feedback. We also run remedial intervention programs, short-term, not long-term, short-term remedial intervention programs. So for some of the children that we assess, we invite them for maybe a term or 2 terms into the center and provide intensive remediation around reading and math and writing. And I'd say there's many children who have come back, parents who have come back, former students who have come back and talked about how meaningful that was in terms of changing the trajectory for their lives, right? So in terms of they were not doing well in school. And as I mentioned before, children are very aware. I mean, I know parents are aware, but believe me, children are very aware when they are not successful in school, and it affects them emotionally as well. So in terms of being able to get the actual intervention that can change their lives, former students have come back and said how meaningful it was to have that intervention for them.
All right, thank you. So, whilst you may not be able to give specific stories, based on how much you have helped persons over the years, you have gotten that kind of feedback from parents as well as from students that you have been assisted by Mico Care. And that is wonderful because it's always good to know, usually it is the feedback that tells us the kind of impact that we are creating. And I was actually surprised to know that Mico Care has been in existence for over 40 years. That is a long time, and I think that we may need to do a little bit more to get it out there to the public for persons to know, because we still believe that there are still a lot of children that are getting lost in the cracks because parents are not stepping out, they are not taking that step in order to get the kind of help that their children need, and I think it's a great disservice that is being done to our children. And it also comes back to, the understanding of the parent as well. Sometimes, they see certain behaviors as just quote unquote bad behavior. They really don't understand that there are serious issues that exist that their child may be facing. And so it is important for them to be able to say, this is something that needs to be looked into on a deeper level. And as somebody indicated, they don't just turn to corporal punishment as a means of dealing with that behavior, because it's really not going to help. It's not going to help. And I think this is one of the reasons why we need social workers in our schools, because the social workers, would be able to identify certain things and then make recommendations for persons to come to Mico Care and get the assessment done, right? And so I think that, we just need to do a little bit more to educate the public about Mico Care Centre, because I believe that you're doing some great work over there. And especially with, what you're saying, your remedial sessions where you bring children in for a term or 2 terms. By the way, is this something that comes at a cost to parents, or is it something that is done by the center free of charge?
It's not free of charge. There is a cost. There's a minimal cost. It's not we have a very much of a sliding scale, both for assessment and for remedial services. In general, I think people appreciate things that they have to pay some cost for, but it has to be a cost that's affordable. So it's not, parents and families are not locked out of the services because of cost, but there is always a cost.
Okay, and that's fair. That's fair. So do you want to, tell us some of those costs, generally speaking?
Because honestly, it's a sliding scale. And I'm going to say, as a clinician, I'm not always aware of what administration determines for the cost. I would say, I don't know if Mrs. Minor Williams, who's on, might be able to say it better. I want to say it's somewhere between 1,000 to 10,000 might be the range. I could be wrong, but I want to say something like that.
All right, so you're not giving us somebody else's.
Yes, this is Mrs. Minot Williams, Anne-Marie Minot Williams from the Mico Care Centre. Yes, good evening. Good evening to you, Corporal Fennel.
Thank you for joining us on here as well.
Listeners. Yes, just to jump in to support Dr. Miller there. The cost currently range, I think, between $2,000 and $10,000. But as Dr. Miller underscored, nobody's locked out because of inability to pay, because we do have cases where families receive the services for free. Okay. Where a genuine case of, inability to pay is established.
Right. And what about payment plans? Do you guys put payment plans in place for persons who can't pay everything up front?
Well, in the case of intervention services, because that is over an extended period, as opposed to an assessment which is done on the same day. But as it relates to intervention services, yes, payment plans are facilitated.
All right. Thank you so much, Mrs. Minot Williams, for jumping in to assist Dr. Miller on the cost. And thank you guys so much for being here with us this evening. All right. I see a question here from Miss Rosie T. And she's asking, how soon does a child get help once recommended? Do parents get assistance from the Ministry of Education on payment? Can you guys speak to that one?
I'm not. I think I need the question clarified. I'm not sure in terms of the timeline is what she's asking about, and certainly Ministry of Education.
So, all right, basically, what she's asking, Dr. Miller, once a recommendation has been made by Mico Care for a child, so the child has been assessed, and there's a diagnosis, and the recommendation has been made. I think she's trying to ask the timeline. How soon does that child get help? So after the recommendation is made, how long after that is there any intervention put in place for the child?
Okay, so as I mentioned before, so the interventions that we usually recommend, apart from the children that we recommend for the remedial services at Mico, in that case, it's usually, I'd say the following term. The following term is probably when that they would get into something like that. So it very much depends on what the recommendation is. There's some things that can be immediate. So there are many, most of the recommendations we make are for things that the school can implement. And so it really is up to the school to implement it. And it very much depends on what the school puts into place. So some of those are very easy things that the school can put into place through their own remediation programs at the school or their literacy coach, etc. So there are things that can be put into place by the school. Sometimes we make recommendations for a change of placement. That might take much longer, actually. So if we make a recommendation of change of placement, so we say this child is probably not going to be not going to get any benefit from being in the mainstream setting, and we recommend special education. Unfortunately, we have very limited spaces. We have very limited special education schools, so there's usually a waiting list. So I can't say, I honestly don't know, because it's out of our hands at that point. So it very much depends on the spaces available at those schools as to how long they have to wait to get in there. So I can't say as to how long that might take. So it really depends on the nature of the referral. Some things can be implemented immediately if they're actually in the place where the school is and the school is willing to implement those recommendations, can be immediate. If it's something that requires something like a change of placement, that might take a much longer time, and I honestly don't know.
Right. And I think it also comes down to parents too, because parents do have a role to play in all of this, right? And so it is important for parents to also implement, the necessary actions once the recommendations are made. So it's not directly dependent on Mico Care or Mico Care alone, because there are some interventions that you do, and it is also time bound or time specific. But also when recommendations are made to parents and schools, then it becomes their responsibility to implement those recommendations at the earliest possible time that it will benefit the child, right? So I think that is what we're getting from Dr. Miller here. And thank you so much for that question, Miss Rosie T. All right. You did make mention of the fact that, there are limited in schools, special education schools, and especially when it comes down to autism. I know for a fact that, there is serious issue with persons getting their children into schools when they are diagnosed with autism. And, I just want to make recommendation for one that we know it's fairly new, but they have been doing a really good job so far, and it's called Carl's Concept. So just in case there's anyone on here with a child that has been diagnosed with autism, then I would recommend Carl's Concept. They are located out in Central Village. That's heading into Spanish Town. It's actually located at the Red Cross building. That's where the school is located. And some of the things that they offer there, they do therapy sessions, applied behavior analysis, aquatic therapy, fine and gross motor skills, sensory integration, reading and writing, self-help skills. So they try to get into helping the children to develop, because as we know, with autism, it affects their socialization. So communication and socialization. And so it is important. And so, it's a fairly new school, but we have we've met with them. We've seen some of the work that they've been doing. We've even, met some of the persons that they have been working with. And so, this is one of the schools that, I would recommend for persons if they have a child that has been diagnosed with autism. Right. So
I want to just quickly jump in, although I'm really glad to hear about that, because we are always looking for spaces for intervention. Right. I want to say generally though, that not all kids have the same needs, and not all children with autism need a specialized placement. So there are many children with autism who are fine in a general education setting, but they still need help for the things that they struggle with. It's not as if you can just leave them in a mainstream class and ignore their needs, because they actually have special needs. So you do need to meet the needs that they have, but they are fine in a general education setting. So not all the children that we see, even if they have a diagnosis of ADHD or autism or something else, need to be in a special school.
Okay, that is noted. That is noted. Thank you so much. All right, so I'm seeing Elvia right in the chat is saying that I believe it's now time for Mico Care to spread their wings more in Jamaica. After 44, after 40 years, the time is now.
Give
So
us the
that's
staff.
all right. But I do want to ask something though, because in the question that Rosie T asked, she made mention about whether or not the Ministry of Education assists with payments. Is there any collaboration between Mico Care and the Ministry of Education as it relates to children with special needs or with learning or intellectual disabilities?
So I don't know how to characterize our relationship. Of course, we collaborate. Meaning that, I mean, the children we see, ministry is ultimately in charge of school placements for children, for school kids in school in Jamaica, right? Unless you're seeking a private placement. So much of the time, based on our recommendations, we'll send them to the ministry to follow up in terms of what actually happens next, because they have authority over the actual schools in the country. We don't. They have authority. So we make a lot of recommendations that is carried out by the ministry, depending on what we're talking about. So recommendations for different placements, different schooling, etc. They're the ones that will follow. Or like I said, in terms of accommodations, right? So children we recognize that in exam situations, they have particular needs. It's the ministry who makes those decisions. We'll make the recommendations to the ministry. They're the ones that follow up with that. So in terms of that, there is that sense of collaboration, meaning that we're working together to try to figure out what the needs are. We'll identify them, and the ministry is the one that carries them out. The payment thing, I wasn't sure. They do assist in payment. So they assist in placement. So if children need a special education setting, again, the ministry is the one that will follow through with that. So they may assist in terms of trying to help with placement for children and paying for that placement, depending if it's necessary.
Okay, understood. So in other words, what you're saying is that, you will make a recommendation and to parents or to schools, and they may need to follow up with the ministry as it relates to, getting a placement into a school. So usually, so basically, in other words, and what you're saying is that the collaboration between Mico Care and the Ministry of Education is relatively limited.
Yeah, I mean, yes, probably we don't have a group meeting where we're deciding together on what happens. We make recommendations and they follow through if they agree. Yeah.
That is understood. That is understood. All right. So I don't know, ladies and gentlemen, if there's anyone on this platform who has a question that they do want to ask, if they want to jump in on the discussion, you can feel free to do so by using the raise hand feature or typing your question in the chat that we can address them. And one thing I do want to mention is that this program is being live streamed on YouTube currently, and the video will be available on YouTube for persons to go back and watch. So if it is that someone was unable to join tonight, you can encourage them to go back and look at this program on YouTube. And you can do that by following our channel, which is CSS North 83. That is CSS North 83. So that is what you would search for on YouTube to get to our channel. All right, so I want to ask one more question, Dr. Miller. What hope or prospects can you offer to parents of children with learning and intellectual disabilities regarding their children's future in terms of development and their integration into society?
Well, I mean, again, I want to go back to what I've been saying. The earlier that you start intervention, but the earlier you start the intervention is better, but intervention is always a good idea. Meaning that there are a number, I mean, research is always ongoing. There's so many research that has been catered to the various varieties of disabilities and challenges that children face, trying to figure out what is the things that are effective. So there is a wealth of interventions available for children with even severe challenges to try to figure out how is it that we can help move this child from here to there. And that is always possible for children. you should never accept that this is just what it is. Like for no child, like regardless of what the issue is that they're facing, there's always a way for us to move forward and to make progress, regardless of what the challenges are. And you should always try different ideas. And there are many evidence-based, meaning we've tried it, it's worked, we know it's effective. There are many evidence-based ideas for all of the things that we have talked about, for autism, for ADHD, for learning disabilities, for emotional challenges, for trauma. There are things that are effective and will help children actually make progress and be the best that they can be. And I definitely always want to emphasize that to parents when I talk to them, that there are always things that we can do to move forward for your child.
All right. So in other words, there is in fact hope for children with learning and intellectual disabilities. And what it really requires from us is effort, taking the necessary steps, doing the things that we need to do to ensure that we help to secure the future for our children that we would want them to have. So it's going to take effort on our part today to help to secure their future for tomorrow, right? And I just want to ask though, as it relates to the different learning challenges and disabilities that we have been looking at so far, or that you have in your experience, that's your assessments that you have made. And one of the things that has come out is that sometimes there are things in the environment that is affecting the child. Have you ever encountered any case where probably substance abuse by the mother during pregnancy has affected the child intellectually?
That's a very specific example. That we do know that substance abuse by the mom during pregnancy does affect intellect, particularly, and people are always somehow surprised by this, but there's a whole fetal alcohol syndrome. So alcohol use, as we know, absolutely affects cognitive functioning. I mean, and in a number of ways, we can actually see the features in child. So substance abuse, we know, absolutely affects how children develop. We have seen some cases. The thing is, I mean, it depends on how much parents will admit to substance abuse, but we have had absolutely cases where the mother was abusing substances, and it did affect their child's development, because we know that it does. We actually know that's been proven without a doubt. We know that it does.
Right. So in a case like that, what help is there for that child?
I mean, similar to any other, so they may have cognitive deficits because of what happened in the womb, absolutely. But similar to other children who may have intellectual disabilities for any other reason, there are ways that we can still help them to make progress using specific kinds of strategies in terms of how we teach. So even though they have these cognitive deficits, and we can't, unfortunately, make those deficits disappear, right? So we can't wave our hands and make ADHD disappear, or autism disappear, and intellectual disability disappear. They will have that, absolutely. But we can use specific kind of strategies to help them make the progress that they need to make. We need to identify what is going on, and then we use our knowledge of how to help them in terms of how we help them to move forward. So there's always help, right? But we recognize that there are these deficits that exist, just like we recognize for a child with ADHD, they may tend to be impulsive. So we need to figure out how can we help them function knowing that.
Right. All right. Thank you so much, Dr. Miller, for addressing that, because, it's one of the things that, in my experience in talking to persons, as you indicated, if parents are honest, or if mothers are honest about substance abuse during pregnancy, then, it would really help to put some things into perspective as it relates to what may be affecting the child. And in my experience, I've recognized that this is something that probably has affected our children on a wider scale than we know. Because especially within some inner city communities, it is common practice for pregnant mothers to smoke and drink, just like normal, that just as they would on a normal day when they were not pregnant. And so, I believe that education is absolutely important where this is concerned so that we can try to remedy that behavior. And maybe, just maybe, we'll be able to see a decrease in intellectual disabilities in our children, And we're coming down to the close of our program now, and it doesn't seem as though we have any more questions that are going to be coming from any of our participants on our platform this evening. So I just want to ask you, Dr. Miller, what are your final thoughts that you want to share with our participants here this evening?
I just want to reinforce some of the things that we've talked about in terms of that there's definitely, absolutely. I want parents not to feel, sometimes we can feel helpless or defeated to some extent by some of the challenges that we face and some of the challenges that our children are facing. I want to emphasize that there are a number of things that we can always do to address challenges. There really are. And so even though it may feel overwhelming at times, and we acknowledge that things can be overwhelming, but we can always try different strategies, and you should always reach out to figure out what are some of the things that are effective in addressing these social things that I'm seeing in my child, these behavioral problems I'm seeing in my child, these language issues I'm seeing in my child, whatever the issue is. And we want to look at the whole child, not just reading, right? So anything that you see that is a concern, there are things that we can actually be proactive about, right? Don't be passive about issues. Don't ever be passive. We can actually be intentional about trying to make our children better, regardless of what the issue is. We can be intentional. There are effective strategies out there. It's a matter of figuring out what is going on, and it's where an assessment can be helpful, or whatever way you want to try to narrow down what is going on. Always try to figure out what is happening and then be intentional about trying to treat it and try different methods, because we can make progress and our children can be better. I want to also emphasize, which I try to emphasize with parents, the importance of being accepting with our children, right? And that I want to say all of us, we all have challenges. I have challenges. We're all imperfect, right? And you always want to I do want you to be intentional and proactive in trying to help children, but I also want you to be patient and accepting of children as who they are. We have challenges, and it's not about making them perfect and not being impatient with all of the things that they have. Be accepting and loving. That's really, 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 really important for our children. You don't want to be yelling like, why are you not reading? You want to just, accept that we have challenges. We all have things that we're weak at. We're going to work on it, but it's okay.
All right. Thank you so much, Dr. Miller, for those words. And I want to join you in emphasizing those things. And I want to add to what you were saying. In many cases, when children have certain challenges, sometimes we can make them feel as though they are less than the average person. We cause them to feel as though they are not as good as or other children who may not have the same challenges that they have. But I want to encourage parents this afternoon, do not do that. Do not let your children who may have challenges feel as though they are less than any other child. One of the things that we can do to help with that is not compare them. Don't compare them to others. Every child is unique. And as Dr. Miller said, every person has their own flaws, their own challenges. And so that is theirs. I don't think, well, not I don't think, but there is no child that wants to give themselves a disability, whether it is intellectual, whether it is a learning disability, whatever it is. There's no child that wants to have that. So nobody brings that on themselves. So it is important for us to understand that this is something that they cannot control. We cannot control it either, because if we could, all our children will be perfect. But we don't have that power. And so, we have to understand that our children will come with imperfections from time to time. And we just have to learn how to accept those imperfections, find the correct ways of dealing with those things. And that will help us and our children to move forward with a more positive outlook and a brighter future. And that is what I want to leave with our parents this afternoon. Do not be afraid to get an assessment for your child. If you believe that something is wrong, if you recognize that your child is performing below the accepted level or the norm for their peers, if you believe that something about your child is not normal, quote unquote, and I want to use that word very, very gently, normal, you know, if there is something that seems out of the norm for us, don't be afraid to get your child assessed. It is important. You know, here in the JCF, we have what is called the early intervention strategy, you know, where we try to assess even our own police officers who may be suffering from whether emotional or intellectual issues. You know, we try to do early assessment and early intervention to prevent things from escalating or going beyond a certain point. And so it is important for parents also to do the same thing. Be proactive in responding or treating with your children's issues, right? So that is my recommendation that I want to give to our parents this evening. And I want to say to each and every person on our platform, it was wonderful having you here, having this discussion. I believe that it was very enlightening, very educational, you know, and I believe that we all learned a lot here this afternoon. So Dr. Miller, I want to say to you, Dr. Shauna Miller, child psychologist from the Mico Care Centre, a big thank you for coming on and being with us here this evening. And I also want to thank Mrs. Minot Williams, who chipped in to give her own, you know, little help to you on this program.
Thanks for having us.
I'm your host, Corporal Kester Fennel, and thank you so very much, everyone, for joining us. And I want to thank my technical director, Inspector Ishmael Williams, who is always here with me, you know, and he is the man that helps to make this program possible each and every month. And I also want to thank the staff of the Community Safety and Security Branch for the role that they play in making all of this possible. Thank you, our community members, for always coming on, joining, participating, getting involved in this discussion and making it so fruitful, so engaging, and so educational. And this is where we take the family. Thank you all, and have a good evening.
Thank you so much, sir.
You're welcome.
Thank you.